Our next guest is Representative Tom Cole. He is the Republican from Oklahoma, the ranking member on the Appropriations Subcommittee on Labor, Health, and Human Services and Education, here to talk about the federal response to coronavirus. Good morning.
Good morning.
Before we go into that topic, quickly, your thoughts about yesterday's Senate vote.
Well, I think it showed how bitterly divided we are as a country. I mean, there was essentially very little partisan crossover other than Mitt Romney's vote on one count. And it strikes me that the Senate, frankly, is a lot like the country. I've actually had constituents that look at the transcript where a lot of this began on one side or the other, and it's amazing. It never changed their opinion. I mean, if you were did not like the president, did not support him, it was, my gosh, I think this is terrible, this is impeachable. If you were supportive, you could read exactly the same thing. I don't think there's anything really there. So I think, this ended where everybody thought it would end. In that sense, it's pretty predictable politically, but I do think it left the country more divided, and I'm sorry for that. And I do think it will make it more difficult in the coming year for us to work together. Not impossible, because we got some big things done at the end of the year and the beginning of this year, things like the USMCA and funding the government. And those were both done in a bipartisan fashion. So it's not like we're incapable, but there's no question there's an aftermath to something like this that takes a while to work through.
The previous guest said that they were able to still continue investigating these type of efforts of the White House while still having the work of legislation done. Do you think that thing can happen?
Yeah, I do think it can happen, and it needs to happen for the country. Look, we obviously profoundly disagree on this issue, but at the end of the day, for the American people, the government's got to run. I mean, we've got to be able to fund the National Institute of Health and the Center for Disease Control to deal with things like this. We need to make sure our military is funded. And so those things need to get done. And again, I was actually very proud of Congress for working in a very bipartisan way to get the USMCA. It's the first trade deal that a lot of my Democratic friends have ever voted for. Give them credit for that. Senate did the same thing. There's some big things in front of us. I think the president set some of those out in the State of the Union where we can work together, everything from drug pricing to infrastructure. So I think we owe it to the American people to work together where we can. And frankly, they'll make the final decision in November about the president's fate and what the appropriate distribution of power between the two parties is going to be. In the meantime, we're paid to work for them. We ought to be working for them.
To the topic of coronavirus, then, where are we as far as federal response and the preparedness of the federal government?
It's actually a good story to tell here, and a good story from Congress's standpoint. I actually chaired for 4 years now the ranking member of the subcommittee that funds the National Institute of Health, Center for Disease Control, the strategic stockpile where we put back medical supplies and vaccines and those sorts of things. And for 5 years in a row, Congress has put more money in those things than either the last administration or this administration asked for. NIH funding up almost 40%, CDC funding, and strategic. And 2 years ago, it's actually something I put in the bill, but it had bipartisan support. We set up something called the Infectious Disease Rapid Response Fund and put back, we had over $105 million in it this year going in. It's helped us with Ebola last year. And now this, so that we didn't wait around for politicians. You literally had money there instantly. Our major health agencies are really led by outstanding Americans. I always call Francis Collins, the head of NIH, the best politician in Washington because he got appointed by both President Obama and President Trump. But it tells you in these areas, bipartisanship has trumped everything else, so to speak. And so I feel good about where we're at. I feel good about the response. I do think, we'll see more cases. This is still an escalating thing. The Chinese, to their credit, I wish they were a little more cooperative than they've been, but they've been much more cooperative than they were during SARS, so they alerted us earlier. Obviously, they've done extraordinary things in terms of quarantines inside their own country. And so far, 97% of the deaths, 67% of the cases are in a single province in China. So the world community's reacting pretty well to this, and we're leading the way. And, as the previous speaker, Congressman Ruiz said, we're working hard on a vaccine. There'll probably be a minimum of a year, though. So we've got to do all the normal public health measures right now, and I think we're doing them well.
HHS is asking for more money for this, $136 million, I think is the figure.
Well, right now, they haven't technically asked. What they've asked for, and they will get, is transfer authority. They're a pretty large budget, and, literally it's $70+ billion budget. So they can move money around here, but they'll get the resources they need. I have no doubt that if the administration comes and there's a request, there'll be a bipartisan response.
Does that come from the rapid response fund that you're talking
well,
about?
we'll probably go through the rapid response fund. So they already notified. They don't have to ask permission. They just have to give us notification. To their credit, they did that over 2 weeks ago. So they were on top of this from the very beginning. Now they've also come back and asked for, which they've gotten, transfer authority so they can move money around. If in the end they need additional resources, and I don't have any doubt in a bipartisan sense that Congress will do that. And we've had 2 briefings. They've been excellent briefings where, again, the head of the Infectious Disease Institute, Dr. Anthony Fauci, was there. The head of the CDC was there. So we've had really, this is one where I think the executive branch has done a good job informing us. We did a good job over years preparing them, giving them the resources. So it's one where we've done to date a good job, but you're always worried about something that's new. And but I would give all concern high marks.
The magazine Mother Jones highlights the work of the fund you talk about and its creation and its funding. But then they added this. On the other hand, in May of 2019, the president's proposed budget for global health was dramatically lower than it's been in previous years. They say $8 billion for 2020 compared with $10 billion every year since 2010.
Oh, well, of course, you have to remember President Obama's budgets were lower than he got too. In this area, Congress has actually overruled. I actually had a discussion when now Chief Staff Mulvaney was OMB director when he was first coming in, and Mick and I served together. I consider him a good friend and a very able public servant. And I said, Mick, let me just tell you, when you're writing your budget, we're not cutting NIH, we're adding to it. We've made that decision. We're not cutting CDC, we're adding to it. I can show you other areas to cut. You probably won't be able to get them through the Senate on a bipartisan basis, but I don't think you ought to cut here. And they did the first year. Then later on, they've come back with much better budgets. But again, this is something Congress does have the power of the purse, and this is something I give my chairman Rosa DeLauro a lot of credit here too. We've worked together for 5 years on this. This is not new, and we saw this coming a lot of years ago. And she was very helpful in getting the bipartisan support we needed when she was in the minority. I've tried to be helpful to her. Because this is something that transcends political divisions. This is important to the lives of every American. And I can just say, after a dozen flat years, for instance, at the National Institute of Health, again, a 40% increase over a 5-year period is pretty substantial, more than either president asked for. Now, to do that, we had to make some tough decisions elsewhere. There's nothing in this budget that doesn't have people that think Head Starts in this budget. There's a lot of great early childhood education, a Title I funding for public schools. So you have to sometimes make some really hard decisions, but I think you always have to put the life and health of the American people first. And I consider these global health initiatives every bit as important to the average American as, frankly, the defense budget. You're a lot more likely to die in a pandemic than a terrorist attack. So we need to be aggressive, and we can do some things as a country. We have the talent, the resource base, the institutional structure. Nobody matches what we can do at the NIH and CDC. But I'm very proud of both parties for having worked together to fund them, put us in the position to